Well, now we're ready to actually use the nebulizer with the child and whoever it is that's going to be using it. And as you can see, I have the compressor on a flat surface. Got it plugged in. I've got everything connected up. We're going to be using the mask with Autumn, and then I have the medication inside. So what I'm going to do is I'm going to come around here and show you how to place it on the face of the child, and then I'll go ahead and actually put it on her first. Carefully wrap it around like so, and then you want to find out from them how it feels. Is that too tight, Autumn, or does that feel okay?
Okay.
That feels okay? All right. So you've got the ability, obviously, to tighten or to loosen with the strings right here. They're pretty flexible. Okay, so the next step, everything is all in position. She's comfortable. You don't want them to be in an area where they're going to be apt to fall off or be jumping around, that kind of thing. As you can see, also, she's got a book here, something to keep her occupied while she's doing the treatment, which is probably going to take anywhere from about 8 to 10 minutes. And then we can go ahead and turn it on. And you know that it's working properly when you see the mist. The mist will be kind of going in and out in accordance with her breath. So that lets you know that that it is working, and it is therefore going to be going into her lungs, which is where you want the medicine to be going. That feel comfortable? Yep, okay. And she can either hold it herself, or you can stay there and hold it for her, depending on the particular child.